Discover the 10 herbs validated by clinical research for prostate health, natural solutions used for centuries, now backed by modern studies for BPH symptoms and urinary function. By age 60, more than half of all men experience prostate enlargement. By 85, it's 90%. Frequent urination, weak stream, nighttime bathroom trips. These symptoms affect millions of men worldwide. Before pharmaceutical interventions, men turned to specific herbs, not folk remedies without evidence, plants that traditional healers observed working over generations. Modern research has now tested many of these herbs in clinical trials. Some show measurable effects on prostate size, urinary symptoms, and hormone balance. If you value evidence-based natural health information, subscribe to Rooted Knowledge. We're exploring traditional remedies validated by contemporary science. Let's begin. 1. Saw palmetto. Saw palmetto is the most studied prostate herb, with over 50 clinical trials examining its effects on BPH. This small palm native to the southeastern U.S. has been used by indigenous peoples for urinary issues for generations. Wahifen istemaun. How it works. Inhibits 5-alpha reductase, enzyme converting testosterone to DHT, reduces prostate inflammation, improves urinary flow, and reduces nighttime urination. A 2012 Cochrane Review found mild to moderate improvement in urinary symptoms. A 2020 urology study showed significant reduction in nighttime urination in men with mild to moderate BPH. Safety, generally well tolerated, can interact with blood thinners and hormonal medications. Typical dose, 160 through 320 mg daily. Effects develop over 4 to 8 weeks. 2. Stinging nettle root. Nettle root has been used in European traditional medicine for centuries. The root contains compounds affecting sex hormone-binding globulin, SHBG, and reducing inflammation. How it works. Inhibits SHBG, which binds testosterone and contributes to BPH, reduces prostate inflammation, improves bladder emptying. A 2013 study in Iranian Red Crescent Medical Journal found nettle root significantly improved urinary symptoms after 6 months. A 2005 study showed improved urinary flow and reduced residual urine. Safety, generally safe with minimal side effects. Use cautiously with blood pressure medications. Typical dose, 120 milligrams twice daily, often combined with saw palmetto for synergistic effects. 3. Pygeum. Pygeum comes from African plum tree bark, used in traditional African medicine for urinary problems. Contains beta-sitosterol, which reduces prostate inflammation. How it works. Reduces inflammation through phytosterols, improves urinary flow and reduces nighttime urination. A 2002 Cochrane Review of 18 trials with 1,500-plus men concluded pygeum modestly improved urinary symptoms and flow measures in BPH. Safety, well tolerated. Source from sustainable suppliers due to over-harvesting concerns. Dose, 50-100 ml twice daily. 4. Pumpkin seed. Pumpkin seeds are rich in zinc and phytosterols. European folk medicine has recommended them for prostate health for generations. How it works. Rich in zinc, essential for prostate health. Contains beta-sitosterol. Improves bladder tone and urinary flow. A 2014 study found pumpkin seed oil significantly improved urinary symptoms after 12 weeks. Synergistic effects when combined with saw palmetto. Safety, extremely safe. It's food, not medicine. Eat 1-2 ounces raw seeds daily or take pumpkin seed oil capsules. 5. Rye pollen extract. Rye pollen extract, Cernalton, has been extensively studied in Europe for prostate health. How it works. Reduces prostate inflammation, relaxes smooth muscle in bladder and urethra, improves urinary flow. A 2000 British Journal of Urology review analyzed 6 trials showing improvements in urinary symptoms and nighttime urination. Safety, generally safe. Use caution with pollen allergies. 6. Epilobium, willow herb. Epilobium has been used in European traditional medicine for prostate issues, rich in polyphenols that may reduce inflammation. How it works. Rich in ionothion B and other polyphenols, reduces prostate inflammation, improves urinary symptoms. European Medicines Agency recognizes epilobium for relief of lower urinary tract symptoms related to BPH. Safety, very safe with long traditional use, available as tea or extract. 7. Cranberry. Cranberry prevents bacterial adhesion in the urinary tract, reducing UTI risk, important for men with BPH who may have incomplete bladder emptying. How it works: prevents bacteria from adhering to urinary tract, reduces UTI complications in men with BPH, anti-inflammatory effects. A 2010 study found cranberry supplementation reduced UTIs in men with enlarged prostates. Safety: very safe. Use cautiously with blood thinners. Choose unsweetened products. 8. Green tea. Green tea contains catechins, powerful polyphenols that may support prostate health. How it works: rich in EGCG, potent antioxidant, reduces prostate inflammation, may inhibit 5-alpha reductase. A 2006 study found green tea catechins reduce PSA levels in men with high-grade prostate lesions. Asian populations consuming high amounts have lower prostate problem rates. Safety: caffeine may worsen urinary frequency. Decaffeinated retains most benefits. 9. Pomegranate. Pomegranate contains powerful antioxidants that may protect prostate cells and slow PSA progression. How it works: rich in punicolagens and elagitannins, slows PSA progression, anti-inflammatory effects. A 2006 study found pomegranate juice significantly slowed PSA doubling time from 15 to 54 months in men with recurrent prostate cancer. Safety: very safe. May interact with medications like grapefruit juice. 10. Beta-sitosterol. Beta-sitosterol is a plant sterol found in saw palmetto, pygeum, pumpkin seeds, and many other plants, studied specifically for prostate health with strong evidence. How it works: reduces prostate inflammation, improves urinary flow, reduces prostate swelling. A 1999 meta-analysis in BJU International reviewed 4 trials with 519 men. Beta-sitosterol significantly improved urinary symptoms and flow measures. Safety: extremely safe, present in normal diet, available through foods, nuts, seeds, or supplements. We've explored 10 herbs that research suggests may support prostate health, plants with both traditional use and modern clinical evidence. This isn't about replacing medical care. Prostate health requires proper diagnosis, monitoring, and, when necessary, medical intervention. But for men with mild to moderate symptoms, or those seeking preventive approaches, these herbs offer evidence-based natural options. What's remarkable is how traditional observation aligns with modern research. Healers noticed saw palmetto helped urinary symptoms. Scientists discovered it inhibits enzymes involved in prostate enlargement. Traditional medicine used nettle root for prostate issues. Clinical trials confirmed improvements in urinary flow. The evidence isn't perfect. Not every study shows benefit. Not every man responds. But the pattern is clear. These herbs have measurable effects on prostate tissue, hormone balance, and urinary function. The best approach combines traditional wisdom with modern science. Use these herbs under healthcare supervision, monitor symptoms, get regular checkups, and remember, natural doesn't mean weak, but it also doesn't mean without limitations. If this resonates with you, subscribe to Rooted Knowledge. We're exploring where traditional medicine meets scientific validation, grounded in both evidence and experience. Thank you for this journey. Until next time, take your health seriously, explore all options responsibly, and remember that men's health matters.